In the summer of 1858, London was choking, not from the coal smoke but from the awful smell of human waste. The River Thames had become an open sewer, the smell so bad it forced Parliament to close, and with the sewage came cholera. A waterborne infection spread through contaminated food and water. It struck fast, causing sudden diarrhea, dehydration, and shock. In the 19th century, without antibiotics or IV fluids, death could come within a single day. Tens of thousands of Londoners died in each outbreak. Businesses shut down, trade slowed, and wealthy fled the city, taking capital with them. This wasn't just a health crisis, it was an economic one. In the 19th century, cities like London, Paris, and New York exploded in size during the Industrial Revolution. Populations doubled or tripled in just a few decades. Overcrowding, poor sanitation, and contaminated water created the perfect breeding ground for cholera. Between 1831 and 1854, London endured four major epidemics. Each wave killed between 10,000 and 30,000 people. Across Europe, cholera claimed more than 1 million lives. The crisis reached its peak during London's Great Stink of 1858. The Thames was so filthy that lawmakers had to flee the capital. That summer, Parliament finally acted. The solution came from an engineer named Joseph Bazalgette. He designed a massive sewer network, 82 miles of big underground tunnels connected to more than 1,000 miles of smaller street drains, all designed to carry waste away, and finally cleaned up the Thames. Built between 1859 and 1865, it was one of the most ambitious public works of its time. It wasn't cheap. The system cost more than £4 million, about $700 million in today's money, but the payoff was immediate. Cholera outbreaks in London virtually disappeared, and perhaps just as important, the project put thousands of people to work in construction, engineering, and maintenance. It wasn't just public health, it was also a jobs program. London wasn't alone. New York had already built the Croton Aqueduct in 1842, which carried water from the Croton River in Westchester County to reservoirs in Manhattan after its own deadly outbreaks. It was one of the largest infrastructure projects in the young United States. Likewise, Paris under Baron Haussmann in the 1850s was simultaneously laying new sewers and water systems after its epidemics in 1832 and 1849. In different ways and at different times, each city came to the same realization. Clean water and sanitation weren't luxuries. They were essential economic infrastructure like railroads or factories. London's sewer project, for example, cost roughly the same as building an entire railway line from London to Brighton. That level of investment established health as a foundation for economic growth. History, however, didn't stop with cholera. In the early 20th century, the world faced a new pandemic, the Spanish flu of 1918. In just 2 years, it killed an estimated of 50 million people worldwide, more than the number that died in World War I. Economists estimate that the Spanish flu cut GDP by almost 6% in 1919, with lost productivity, overwhelmed health systems, and widespread business closures in most countries. Once again, most of the investments came after the damage was done. Hospitals scrambled to expand capacity, cities imposed emergency closures, and societies absorbed enormous losses. The pattern repeated. Response came quickly, but prevention had been neglected. And then, a century later, came COVID-19. By 2022, the World Bank estimated global economic losses over 10 trillion in output. The difference this time, we had better science, faster vaccine development, and stronger health institutions in some parts of the world. But the same challenge remained. Prevention and preparedness are far harder to sustain than emergency response. Cholera sewers, the Spanish flu's emergency hospitals, even COVID's vaccine rollout, these were all largely reactionary. But the prevention requires a vision and long-term commitment. And it's where the economic payoff is greatest, but also the hardest to sell. That's why I asked Magnus Lindelow, the global program lead for pandemic preparedness at the World Bank, what makes prevention so difficult to prioritize politically and financially, and how do we change that?
First thing to say is, when people talk about prevention, they kind of sometimes mean different things, right? So the sort of, you might think of primary prevention is sort of preventing these spillover events from happening, right? So a lot of pandemics are a result of something hosted by an animal and spilling over into humans, right? So preventing those events from happening, that's really complex, and it's not a sort of health sector agenda. It's really about natural resource management and where people get their food from, and how limiting sort of reliance on wild foods in some regions. That's a major source of outbreaks. It relates to how livestock industry and agriculture sector in general operates. So it's sort of, the complexity there is that it's not a health sector agenda. It's not easy to point your finger at, you need to do this. There are very fundamental changes in terms of agriculture, sort of management of natural resources, et cetera, that need to come into play. So you have a lot of sectors, you have a lot of difficulty in saying what is most important in that space. So that's kind of one challenge. But often the other dimension of sort of prevention is the preventing, when these sort of spillover events happen, preventing that from becoming a large scale outbreak, right? And that really comes down to that very being countries being able to have the intelligence, surveillance systems, the health system to pick up when something strange is happening, to investigate that quickly, to act on it, and contain it. And, this is what sometimes referred to as sort of the epidemic and the pandemics that don't happen. We don't hear a lot about that, right? But there are a lot of incidents where this something happens and we get control over it relatively easily, or not easily, but quickly. And that's what really needs to be celebrated. And it comes down to sort of, as I was saying, it's the basics of there being a health system that picks this up, and then the kind of core capacities of just getting out quickly, responding, identifying what the problem is, figuring out what to do about that problem, right?
Public health infrastructure turns out to be one of the highest return investments a country can make. Today, economists estimate that every dollar invested in clean water and sanitation yields $4.30 in economic returns through reduced healthcare costs and higher productivity. And the same holds true for health more broadly. The Lancet Commission found that nearly 24% of full income growth between 2000 and 2011 came from health improvements across developing countries. That's almost 1/4 of economic growth driven by better health. The World Health Organization estimates that increasing health spending by just 1% of GDP could save over 60 million lives and boost economic growth by 2 to 4% in low and middle income countries. The numbers seem clear. Investing in health fuels growth. But there's a challenge. These investments generate high returns over time, yet the upfront costs are significant. In the 19th century, governments in London or Paris could deploy public resources to build aqueducts and sewers. But today, in many developing countries, governments alone can't carry the financial burden of building hospitals, labs, and vaccine plants. This is where the private sector must step in. Not just a source of money, but as a partner in developing solutions. And that's a space where the International Finance Corporation plays a key role. So I asked Zeynep Kantur, the global head of health at IFC, how partnerships with the private sector help make these large-scale health projects possible, and why mobilizing private capital is essential for pandemic readiness and long-term growth.
So just to give you a sense, I talked a bit about the demand supply gaps in healthcare that already exist. There's actually an estimated 170 billion plus annual funding gap to close these health access gaps. And this is without a pandemic. And currently, the fiscal budgets of the governments and a diminishing grant funding environment means that the bulk of this funding will need to come from the private sector. So without mobilizing private capital, we will not be able to make the investments necessary to close the health service and product gaps. But mobilizing the private sector goes beyond just financing, because the private sector in many cases can show the agility and the innovative capacity to respond to fast changing environments. So many governments are now actually looking for mechanisms to leverage the private sector capabilities and or innovations to also close their gaps and strengthen their health systems. For example, the use of AI for product development or demand predictability or prevention. Those kind of technological innovations are mainly coming from the private sector. So mobilizing both capital and the private sector innovation across the health value chain is incredibly important for pandemic preparedness, but even between pandemics, peacetime needs.
The lesson from cholera is still with us. Ignoring public health always costs more than fixing it, but history shows that we're still better at reacting than preventing. The Great Stank forced London to act, the Spanish flu accelerated hospital expansion, and COVID triggered trillions in emergency spending. However, prevention and preparedness require a different mindset, treating health like insurance against uncertain risks. The real test isn't how much we spend once a crisis hits, but how much foresight we have to invest before it does. Healthier populations make wealthier nations, and our future prosperity depends on remembering that.